There are a range of different recommendations that can be implemented to help improve the mental health of prisoners. These include changing characteristics of the prisons, screening prisoners for mental health issues, providing access to healthcare services, and giving them meaningful daytime activity. According to the WHO and Red Cross, enforced solitude and isolation from social networks can contribute to poor mental health of prisoners. Changes can be made to provide prisoners with more contact with their social networks outside prison, as well as removing solitary confinement. Screening prisoners for mental health issues upon arrival is important to be able to provide them with access to the right kinds of services for their needs. However, practical limitations such as overcrowding make it difficult to screen upon arrival. Hence, the WHO recommend increasing staff training to be able to conduct a more detailed screening in the next few days after arrival in prison. With regards to healthcare services, for prisoners who suffer from substance use disorders, detoxification upon arrival is recommended. Research by the Center for Social Justice has shown that only about 31% of opioid addicts are detoxified in prisons in England and Wales. Therapy, such as cognitive behavioral therapy, should also be given to prisoners. CBT is a therapy which focuses on changing harmful thoughts, feelings, and behaviors that can contribute to psychological distress. Research has shown that CBT is effective at improving psychological well-being and reducing reoffending rates. For meaningful daytime activity, prisoners should be given education and courses. Research also shows that implementing yoga programs can help reduce psychological distress in prison populations. Some limitations of these pieces of research include that it is largely done on a small scale, questioning validity. It's also mostly done on male populations, so it's questionable whether it can apply to females. All prisoners are also different, and therapy is an individualized process, so it's difficult to determine interventions that can work for everyone. In terms of practical limitations, these require a lot of funding, making implementation difficult.